We're going to talk about cholesterol and kidney problems. My name is Isaiah Kofi Apia. People call me Nana Abebiu. That's what I prefer calling because when I'm doing interviews, I go by Nana Abebiu. What's your name and what do you do here in Abu Hospital?
Okay, I'm Antonio Daniel Nimati, a biomedical scientist, and I am currently the head of hematology unit. So I take care of the hematology where we run normal basic full blood counts and then other ANC tests.
Okay, this gonna be like we're gonna blend the language. We speak English and Tree. I understand he can't speak Tree, so I have to explain whatever he's saying to audience. You know, the GBC thing na or kasa. Nah, then maybe I'm sure I wasn't maybe I'm sure I see, you know, I will just do that. But it's good because it's gonna give us more views. Those who cannot speak Tree will understand what you're saying. Okay. Yeah, can say cholesterol. We've been saying cholesterol. It's a case of cholesterol any day. What is cholesterol?
Okay, so when we talk about
Can you speak louder?
Okay, so when we talk about cholesterol is part of it, the full part of it. So when you come to the lab, we are in charge of assessing or testing or finding out the level of this cholesterol within your blood. So we look at cholesterol, we have something called triglycerides, and we have something called the HDL and then LDL. All come together to form part of your body lipid. In general, we see that and well only pedium.
Okay.
So that's what we basically do. So the cholesterol is part of that collective panel, being part of the lipid within your body.
So what are the causes of cholesterol? What brings cholesterol?
Okay. Cholesterol is in everybody's body, and it's some of the factors that can influence cholesterol going high can be your diet, not exercise, and stress can all influence your cholesterol level or can affect your lipid level. So mostly we advise that patients eat early, exercise regularly, and then be careful with what they take in, especially the junky food can also influence your cholesterol levels. So
those in America who have been taking in McDonald's and others junk foods should be very careful when taking it.
Yes, we would advise that. We are not saying don't take it, but be careful with the how regular you take in this diet. Which kind of
so the level of your cholesterol, does it have something to do with your let me say your blood group?
No, they are two different things. So blood group basically talks about your antigens within your blood, and then that one, everybody has unique blood group. However, some people in Ghana have not seen any paper on that associating the blood groups with cholesterol. But people believe that some blood groups can influence the level of cholesterol in an individual. So for now, we don't know if that scientifically proven that individual with specific blood group can have high levels of cholesterol.
Okay. If you said before say blood group no and cholesterol no doesn't match because obi onuma was obi A oni kwase orenam my cholesterol obi A positive obi O was so dikusua pa you can say oni kwase nipa we edinam but O but obi A dia I was say with every meat. So that's why I asked you that question. Does it have something? Does it have a link to cholesterol?
Okay, so scientifically, we are yet to see any paper on it or any recommendation from WHO stating that individuals with specific blood groups should eat certain kind of food. However, in Ghana, there's a perception that individuals with certain blood group can't eat certain diet and can't eat certain vegetables. I remember hearing on the radio that a herbal doctor saying that individuals with blood group B can't take in tomatoes, or tomatoes can sometimes affect their well-being, which I have not seen any people on. However, I'm a blood group B and I take in tomatoes and I'm living healthy. So.
That means the guys on radio every morning, every afternoon talking about blood group, their herbal medicines, herbal doctors, they don't know what they're saying because at times we listen to these guys and we are like, you don't even know what to eat.
Yes, in a way, but I wouldn't say all of them are bad. Some are doing so well, and herbal medicine is really good, but I think there should be government or the Ministry of Health should pay more attention there, where we will try to educate the individuals in the herbal sector to get to know more about what they are doing, just not to throw chaff into the eyes of Ghanaians. So I think herbal medicine is really important, but we should be careful with who we listen to and then the people we visit when we are going to the herbal care centers.
There is a question I want to ask. If I or trade before herbal medicine, say obi ebe can say group black group B into tomatoes now or can already also, but he has not seen in documents people be and as be a say any kind say o black group na bia into tomatoes and then no one some all can na or rattle us and rain and what about autograph and you only say maybe say there was Sradie and so what is different between what is can you just let us know the difference of that?
That's why when I started
can you speak louder for me?
Okay.
Can you speak like a man?
So that's when I started the talk, I indicated that when we say cholesterol itself is part of a collective, let me say, items that form the lipid panel. So in total, when we look how we say Stradie, it contains all of them. Basically, when you take in food, the major, we say, and what going into your body is triglyceride. However, it's breaking down to these various components where we talk of the cholesterol, which is part, then we also talk of HDL, which is also part, LDL, which are all parts of the panel. So together, they form what we call the lipids. However, in Ghana, the moment someone say cholesterol, they generalize it for all the lipids. Cholesterol is part of that panel. So together we call it Stradie in Ghana. However, it's part of it, and then they are blessed.
You made mention of good cholesterol and bad cholesterol. So okay, can you just throw more light on it? Because just let's take it like good cholesterol. So when we come to good cholesterol, this is what we get from it. This is the causes for us to get good cholesterol, and what is that for the body, and either is good for the body or bad for the body. Then after that, we come to the bad cholesterol. So let's take it one by one. So now which one do you prefer speaking?
Okay, so I'll talk in general that lipids in general, they are not bad for the body. Actually, it's really good in terms of your cellular development and maintaining of the cellular integrity. It is really important that you all have lipids in our body. However, when it becomes excess, that's when it builds up in your blood vessels where they can cause diseases. So we have a name called the HDL, which is the good cholesterol. And what it does is that it mops up the bad cholesterol from your body. So mostly when the doctor asks you to come and run a lipid test, we look at the cholesterol, the triglyceride, the HDL, and then the LDL. The HDL, which is the good cholesterol, we expect it to be a bit slightly bigger or higher than the LDL because that's the good cholesterol. That one is the one that mops up the bad cholesterol within your blood vessel. So good cholesterol, which is the HDL, is really important and it's produced by your body. But however, when you eat more of junk food and all those food or late night eating, not exercising, you tend to change the pattern of which the HDL is produced. And you tend to have more of the bad cholesterol compared to the good cholesterol.
Okay, let's say my name is Ama Sidua. I went to the hospital and I've been told that I have my cholesterol level is high.
Okay.
I used to eat eggs and meat. Would you advise me to stop eating eggs and meat?
It depends on how often you eat them. They are good, but if I'm the doctor, because I'm not the doctor, I'm a lab scientist, mostly I do the testing. However, recommendation that I would give to the doctor is that you advise the patient that they should reduce the level of intake of those products. They are good, however, reduce them so that, and then exercise more, reduce the level of stress because you don't exercise, you tend to build up the fat. Example is that you have a bottle of, let me say, mixture of maybe oil and then something. When it settles down, you see how it builds. That's how the body is. If you don't exercise regularly, you tend to build your cholesterol because you are eating and then you are not exercising. So you build it up and then when stress comes in, then it becomes worse. So you advise that, not that you stop eating it, however, you reduce the level of intake and then you exercise more.
Okay, so now Amma Asidua has cholesterol, and I want to ask you, he or she doesn't want to be on drug or medication. So are you telling me by eating good and exercising well alone can help her get out of it?
Yes, it can reduce it, but drugs are also important because sometimes it gets to a point where the patient needs to be on drug to quickly, for us to quickly see the effect, because not everybody can exercise. Imagine if she's old or she's grown, you know that the person has other duties, and then time factor comes in where the person not get time to exercise. So I think drugs play an important role. So when she comes in, although the doctor will put her on medication, the best advice for her is that eat well, don't eat late, and then exercise more.
So when you put a person on drug, is he or she gonna stop for some time after some time, or gonna be for life?
Okay, so they monitor, the doctors monitor, and then when there are changes and then it's beneficial, then they stop you, they ask you to stop.
I remember I went to the hospital and they checked me and they said my cholesterol level was 252.
Okay.
So I went to see the doctor and the doctor said, "Oh, yo, you're a young guy, I'm not gonna give you any medicine for that. What I want you to do is go out there, watch what you eat, do a lot of exercise, and you're gonna be good. And trust me, within 3 months, I went back and he said, no, you're okay, you cleared." So I think you're saying the right thing, because
Okay, so mostly when it comes to medication, doctors are very careful. Unfortunately for our part, sometimes the doctor attending to you might be lazy, where the person will not pay attention to certain specific details. So, but you know, outside Ghana, they are careful with the medication they put you on, because in case of anything, let me see.
there'll be
charges to it.
charges to it.
They are careful with how they administer medication. I think currently Ghana is trying to improve in that. So not everybody that has high level of cholesterol that we advise that you put the person on medication. Because sometimes with a little bit of exercise and then eating well, the person will get back to his or her normal status.
So, okay, that's high cholesterol. Okay, what are the sicknesses or diseases that high cholesterol can cause?
Okay, so we know that we mostly think that hypertension is one killer disease, and then we don't mostly pay attention to it until we get to a certain age. Then you come to the hospital and then they tell you that you have hypertension. So some of the factors, some of the effects of high cholesterol is that it can block your blood vessels and then increase your blood pressure. So cholesterol can result in that. Also, having high cholesterol, most of the men can say that you have hot bellies, and then it can go to that, and then and then it can also affect your tubes, which can affect your kidneys as well. So
yeah, we'll come to kidneys. Okay, yeah.
It plays a major role in everything. So your cholesterol levels being high means high hypertension, which is lower circulation, and then your kidneys will be having effect because of the increased blood pressure. So cholesterol increase basically is really something we need to pay attention to.
So meaning, if somebody is a patient, an hypertension patient, and do exercise a lot, watch what he or she eats, he can get away that hypertension, right? Because if the cholesterol reduces, so now what he's saying, if the veins are blocked, that causes hypertension.
Yeah,
So if I'm able to control my diet, I eat well, I take my medication, everything, I do my exercise, I don't eat late, and the veins are cleared, that means I'm hypertension free, right?
Okay, so you will be free, but with normal blood pressure in general is something, even your normal body, it's, let me say, pressure, you can't regulate your pressure. Yeah, or let me not say you can't regulate it, but it's not stable. It depends on your status or your how you regulate yourself in terms of your exercise, what you eat, the stress, and everything plays a major role in your pressure. Cholesterol can also can cause you to get diabetes. There are a lot of factors like disease associated to increased level of cholesterol. With exercise or regularly checking your diet, I think it can help you build or be safe from developing hypertension.
Yeah,
some of the cause diseases associated to increased level of
speak louder for me.
Some of the causes associated to increased level of your cholesterol, your lipid, you can have stroke, diabetes, atherosclerosis, HPT, hypertension, and then almost everything has been associated to increased level of your cholesterol. And you need to be careful with the level of intake of this junk food and then increased level of fat intake.
So that means if you do away with the cholesterol, you can do away with sugar, you can diabetes, you can do away with high blood pressure, you can do away with a lot of sicknesses.
Yeah, you can do away with a lot of them, but however, currently genetics is also coming into play a major role, saying that not only can this lipid levels affect it, however, certain genetic factors based on pre-exposed factors from your parents can be passed on to you where you can be associated to develop these diseases. So when you look at diabetes, currently genetics play a major role in diabetes.
Okay.
When you look at type 1 diabetes, it's solely genetic related. And then currently
Yes, speak loud for me.
Currently with the type 2 diabetes has also been associated to genetic factors. And then with outside Ghana or outside the world, the advanced world, they are currently dealing with what we call epigenetics. That's things your parents did that influence their genetic materials, and then they pass it on to you. All these factors can predispose you to certain diseases, of which diabetes is part. So not only the lipid that can influence you in developing certain diseases, but these genetic factors are also now coming into play in association to diseases.
So can you do away with diabetes? If you're diabetic, can you do away with it?
Currently, there's management of diabetes. There's no exact treatment or curing of diabetes in Ghana as of now.
Okay. But I know of a friend very close to me who was a diabetic patient, but now he's no more a diabetic patient.
Treatment in Ghana or outside Ghana?
Outside Ghana, US.
Yes. So that's the issue with Ghana, lack of a lot of this infrastructure, amenities, and this technologies. We are currently still working with basic sugar testing, blood sugar testing to confirm even diabetes. Hardly do we do the genetic aspect of the disease.
Okay, I wanted us to go deep into the diabetes, but when you first say idea agroye there na idea sabe before me ko kana obi ma be yan tokwa and you me say ye di besi ya no say na nyan krompon ye adoma ye besa aba na ye ne doc aba be kasa for kidneys no e kwa be na boss o run so kidney problem no obi o kidney problem be we we will come again and talk about kidney, how to keep our kidneys safe. Because we don't know the kidney and the leaders as say was see a bunidia or the sorry fee or the kung fee or the herbal medicines. Meanwhile, some the kidney and answer, but the person doesn't know. So next time you need doc ever have a casa. No about the quiet kidney a pass with damage and the quiet before one you beat me a treaty. And as I said, a care about us a care about that you're gonna do. So people, this is Last Stop TV. You come your way next week. Bye bye.